To my explainer tonight, and it's all about the COVID-19 crisis. I want you to take a look at some of these numbers. Over the last couple of days, you will have noticed that the numbers have been steadily on the decline. If you take a look at the positivity rates all the way from the 10th of February up until today, numbers have been consistently below 1%. We'll get to those numbers in a moment and show you, but in fact, we had and recorded the lowest numbers I believe on Tuesday this week, recording a positivity rate of 0.4%. That would have been the lowest numbers we have seen in the country, I believe, in the last 2 years of the pandemic. So just what is going on with the COVID-19 crisis? Have we finally flattened the curve? Have we beaten the disease? And what is the way forward? We'll continue with those numbers in a moment, even as we continue with my conversation this evening on The Explainer. That's Dr. Ahmed Kalebi, who is a consultant pathologist, and he joins us tonight here on The Explainer. Dr. Kalebi, it's always good to speak to you. Tell us, what can we infer from these low COVID numbers? Is the worst over? Have we flattened the curve?
I think, yes, I think the worst is definitely over. I can say we are in the best place we have ever been since the pandemic started. I mean, we got our first case on 12th of March and also the 13th of March, and that's 2 years ago. Yeah. And this week we had the lowest positivity rate ever recorded. That's 0.4%. It means less than 1 out of 100 people walking around are infected. While, if you remember, about a month ago, we had hit the highest positivity rate of about 35%, yeah. Which means if you go into a matatu, 1 out of every 3 people were probably infectious at that time. Right. And right now it's basically negligible, and even the caseload is down. If you look at our ICU admission, is less than 5 cases. Yes. There's a time we had more than 250 last year during the 3rd and the 4th wave. So I think we are definitely in a good place, and I think that definitely the worst is behind us. Yeah.
Okay, and why is this? Why do you think we seem to be doing well?
I think there are a couple of reasons, but the most important is we have been faced by 5 waves. After 5 waves of the same infection, the same virus, even if there's some mutations, you're getting people having immunity because of natural immunity because of past infection. Mm-hmm. Actually, I think the data was showing that more than 50 to 70% of people have been exposed. And now with Omicron, which was the 5th wave about a month, 2 months ago, I think more people have been exposed, more people have been infected, more people have immunity, but we also have vaccination. More than 26% of the Kenyan adult population now have been vaccinated. And remember, the most vulnerable people have been vaccinated. More than 90% of the frontline workers, healthcare workers, more than 50% of the elderly. Most of the people who care about themselves have gone for vaccination. So I think overall, we are better off. Deaths are going down, so we're definitely in a good place because of all this.
Yeah. So now that is the case, and it seems to be perhaps similar, around the world. What happens to, mask mandates and other restrictions? I'll give you an example. The CDC is set to loosen its guidelines on indoor masking. Germany is planning a 3-step plan to lift most of the restrictions. The UK is in fact planning on lifting many of the restrictions next week, a month earlier than their expiry. What would you say? Should we start to consider the same thing, easing the restrictions?
I think, first of all, in terms of the social restrictions like curfew, lockdowns, restrictions in churches, places of worship, schools, those have been fairly lifted. I think there's a lot of pressure on the president and the government to actually reintroduce some of the measures in December when Omicron started, but most of us said, look, Omicron is mild. So I think the government did the right thing, and so even without those restrictions, Omicron came and left. But now I think things like the mask mandate, asking people to mask. You see people on the streets worried about askaris arresting them because they're not holding masks. I think that has to stop. Yeah. We don't need masks particularly at this point in time. And I think that is the direction most of the countries are taking, like the UK and other countries. Yeah.
And even, Dr. Kalebi, if you take a look at the political situation in the country right now, I'm sure we have some images we can show people, images that they see themselves every day. You've got political rallies packed with thousands of people, absolutely no distance whatsoever, many of them not wearing masks. You've got children going back to school, and we haven't seen another outbreak. So perhaps a sign that maybe masks are not quite necessary?
People have taken it to themselves because there's been a failure to communicate effectively. If you've noticed, what has happened is COVID has been fairly seasonal now. We've had the first wave in around July, August in 2020. Then after that, we had in March. then July, August, then November, and then now this year we're having it again. So I think what is happening is it tends to coincide with the peak wave of the respiratory flu. You know, you usually get flu around March, then around July, which is the highest, then around again November. And I think this is what is happening right now. So the next wave we can expect, which will probably be very mild because we know most people have immunity, will probably come towards the end of March. So in between, I don't think people have to be asked to wear masks. And literally what you are saying, I mean, if you go to Kibra today, I was in a football match the other day, and nobody is literally wearing masks, and people are telling you Corona imeisha. And personally, I actually think there's an element of truth to that. I think the pandemic is definitely over. The virus is not going to go away completely because it's now here with us. But what has happened is that the virus has mutated, it has become more efficient, it's become like other other coronaviruses that we had before.
So do you see a future of us having, you know, other big waves this year?
No, I don't think, I think the worst of the pandemic is over after 2 years. And this is very similar to the previous pandemic in the early 20th century, whereby after 2 years, people have become adapted to it. The virus has also mutated and adapted. So I don't think we'll ever see similar waves like what we had before. And in any case, we are better off in handling COVID. I mean, in the early stages of the pandemic, we were all panicking. We didn't know what this virus was about. The first 2 waves, we were learning about the virus. We were trying to get our ICU capacity on. We were trying to get oxygen. But right now, I mean, we only have 3 patients in the ICU in the whole country, and we have much bigger ICU capacity. We have better facilities. Doctors are more aware of how to treat COVID. People are more aware of how to deal with COVID. So I don't think we'll ever see the same kind of devastation that we had in the past, the same kind of panic. Personally, if you ask me, I think we are in the pandemic endgame.
Okay, but speaking of which, we've got new variants that keep coming up. We know this to be typical of viruses and specifically of COVID-19. Should we be worried about new variants that may come up?
Not really quite, because right now the only variant which is being of concern is the Omicron variant, the BA2. But the good thing is most of the people have already gotten infected anyway and they have vaccinations, so we're not seeing a lot of deaths and so on. But other variants will come up. But even these variants, as they come up, I don't think they'll be as efficient as Omicron. Omicron swept the whole world off its feet. It has spread across the entire world. Most people are now having immunity. Even if we get a new variant coming up, and remember, these variants come out every day. There's mutations every day. But the chances of a new variant spreading the way others have spread, I think it will be highly unlikely.
Because it's encountering people who already have immunity.
Like we here in the studio, if I came with COVID today, the chances of it spreading to the rest of you, even if you contracted it, you'll probably clear it very, very fast because you already have immunity. Most of you guys have been vaccinated. Most of you guys have had past infection. And the science is showing that people who have had past infection, all they need is just 1 dose of the vaccine to get very effective immunity for more than a year.
I see. Thank you very much. We certainly look forward to better times ahead. And like you say, hopefully the worst is over and we've learned our lessons, know how to handle this. Dr. Ahmed Kalebi, a consultant pathologist, always great to have you. By the way, you should be following him on Twitter. You know, his tweets are easy, simple to understand. He's a world-renowned microbiologist and pathologist, but keeping it simple for all of us to understand. Nevertheless, still continue to wash your hands and keep safe, because washing your hands doesn't just save you from COVID, but from a myriad of other diseases. That's our explainer tonight. Let's take a break. We are back with the day's business news.